Dwayne, I'm really loving that background.
Oh, thank you.
That's not what it looks like outside.
No, we're all about imagining where we are right now. We'll go ahead and get started for today, everyone. Good morning, happy Friday. I hope this week has been good for folks. I know we continue to get lots of new information each day as this coronavirus continues to go on. Thank you all for being on today's call. As you can see, I'm currently in Ilha Bela, Brazil, but really only in my mind and virtually. About a month ago, I actually was in this place and it was magical, and now we have snow again. But I think that's the joy of some of these virtual meetings, is we can sometimes just plan where we would like to be in this current time. And if folks have questions on how to do a virtual background in Zoom, I'm happy to answer that maybe at the end of today's call, or shoot me an email. It's really easy to do. All right, so let's go ahead and get started for today. Just a reminder, if folks have questions throughout the webinar, please feel free to use the chat log, or if you have resources to share, feel free to use that. I do have everyone muted. You are able to unmute yourself if you do have a question, but please only unmute yourself if you have a question or a resource to share. So let's go ahead and get started today. We don't have a ton of new things to update folks on today, but I want to make sure that folks understand kind of the baseline information that we've been putting out, as well as share some new resources. And we did have a couple of pieces of clarification from the state. Really what we're here to talk about today is just to make sure everybody is on the most up-to-date page on all the resources going out around COVID, get your all questions answered as you're seeing this impact your practice, or many of you who might be students or faculty as well. And then as well as provide a forum for folks to just share their experiences. One of the things that we're gonna do today, if we have time, is at the end, just open up the floor for folks to just talk about what this has been like for you all the last couple of weeks, how this has impacted your practices, your organizations, what sort of support you might need, the good and the bad, because we know while there's been a lot of really fast-paced changes, there is some good that has been coming out of this, and we want to make sure that we are reminding each other of those goods, and also reminding each other that we're all kind of in this at the same time. So as we kind of move on, our main thing that we're going to be talking about today is just a quick follow-up from some of our last meetings, provide an update on some of the most recent executive orders, talk about some mental health hotlines you may have been hearing about, give some folks an opportunity for some political advocacy and to get updates on that. CE updates, some news from LARA, and then some new resources and training opportunities. Okay, so, and I will do a couple of screen shows for folks, and I just want to make sure folks are aware how to access some of the resources that we have been putting out. So one of the really good places is if you go to the NASW Michigan website, and I'm just going to do that right now so everyone can see what that looks like. You can just go to naswmichigan.org. This will be what it looks like when you go on there. And if you just go up to this COVID-19 resources, there's a whole bunch of tabs here, which you can navigate at your own leisure. We are trying to update this daily, or as we get new information, especially as it becomes to training, other training opportunities, whether it's NASW National or other things that we find or we hear from social workers. So this can include free CE opportunities, maybe things that are related to practice that don't have CEs, like you'll see there's one around making funerals meaningful. This happened, I believe. It may just be available from webinars now. Yeah. We have stuff from the Center for Medicare, Medicaid, nonprofit resources, that sort of thing. So feel free to utilize any of these. Any social worker can access these. You won't need to log on to a membership to access that. The other resource I wanted to share with folks today, and if you joined us for our telehealth and billing webinar yesterday, you may have seen this, but I just wanted to make sure that you all on today's call were aware. If you are a NASW assurance policyholder for liability insurance, and even if you're not, all these resources are free as well. There's a lot of really excellent resources around telehealth right now and billing and liability. So we know that that has been some of our main questions that have been coming in from members. So if you go to the Assurance Service website, which is just naswassurance.org, this will be their main home screen there. And if you can click on this Considering Teletherapy link, there's going to be a few really good resources right here. One of them is this frequently asked questions about teletherapy. And this goes through in a really easy format to follow some of the critical questions that they get around teletherapy. So are there mandates for all records to become electronic? You can click on that, or any of these particular questions, you know, as it relates that you might be having around telehealth. They've probably already answered it there. The other resource that they had that I thought would be helpful for especially folks who are in private practice is they have a teletherapy consent form. And this is a template that folks can use, an informed consent form for telehealth. So if you are looking for one to integrate into your practice, this is going to be an option for folks. You can tweak it to what works best for you, but that example already exists for folks there. So I just wanted to show a quick little demo of their website just so you all could see how easy some of those were to find. Because I know sometimes there's so many resources out there. So just wanted to show those for folks. Okay. One of the follow-up questions that we have been getting since pretty much we started doing this call was, can those in private practice file for unemployment? And initially it was kind of this gray area since many folks are contracted or self-employed, but starting this past Monday, folks in that category could file for unemployment. So yes, if you are currently not working due to the coronavirus in kind of a private practice or a self-employed setting, you can file for unemployment through Michigan.gov. We know that there has been glitches and long waits for that. I'm sure you're helping your clients with that right now as well. So be as patient as possible with folks who are working from the uninsurance office right now. But yes, folks can file for that right now. And I see that there are some people that are typing in the chat box. There's also some people introducing themselves. Feel free to do that if you want to do that. Algeria, our policy director, is in there asking or answering questions. We have our board president-elect and some of our regional representatives there. So if you want to get connected more locally, they're also going to be in the chat box. Okay, so a couple of the executive orders. Sorry, skipping ahead. You probably saw most of these. These were follow through from last week. The stay home, stay safe order was extended through April 30th. And if you were here in Lansing, you saw a nice and rowdy group of people this past week. But that has been extended through April 30th. The schools have been closed for the rest of this academic year. And Michigan has been declared a state of emergency. That happened a couple of weeks ago, but that's very important in terms of funding and how kind of services we get. The most recent executive order, we're up to 50 so far from this crisis, is to protect residents in nursing facilities. So I don't know if folks saw this, but this is a really also important executive order because we know that this virus is especially susceptible to folks who are older and in care facilities. So this puts protections on those organizations. It puts some guidelines for agencies like that. They need to separate folks into different wings if possible. It also makes sure that medical equipment is available for those sort of organizations. So if you work in that sort of a setting, I definitely make sure that you're up to date on that particular executive order, and that's 2020-50. The one that probably most social workers have been asking about was Executive Order 2020-13. That is now Executive Order 2020-49 because the dates got extended for these, and that impacts social work renewals and licensure. We talked about this at last week's meeting, but just a reminder that currently you may renew your license if you do not have your continuing education requirements met. That allows LARA to have some flexibility with folks right now who may have had courses scheduled to go to or conferences that got canceled because of the coronavirus. When we talked with the Board of Social Work, right now what they are doing is they are recommending that if at all possible, social workers try in good faith to get your continuing education before the end of this month if you are up for renewal this April. If there are no courses available because of coronavirus in your area and you have tried, just make sure that you have all of that documented right now, and they will take that into account if you get audited next year. So again, document, document, document. The other thing that was in that executive order is LARA may recognize hours worked towards responding to COVID-19 as continuing education courses. So this is a very gray executive order. There's no specifics about what hours worked responding means. So we're taking that as like an ethical, you're being ethical about what you're going to propose if you are relying on this sort of executive order for your continuing education. So whether you're a frontline essential worker, maybe you're doing research, maybe you're running a food bank right now, you know, we're assuming that those sort of experiences could fit this executive action, but what LARA and the Board of Social Work are really going to look at is if it was an emergency circumstance and that was the only way you were going to get your continuing education in this particular case. So we are hoping that most folks aren't going to need this executive action, but it does exist there in case you do. There are many organizations that have been moving their CEs online, including we've hosted quite a few over the last couple of weeks. And just a reminder, as it relates to continuing education, half of your credits can be through what's considered alternative learning, and the other half do have to be live synchronous. But live synchronous can also be what we're doing right now. As long as it's a live presenter talking, that can count as a live CE. So the one we did yesterday, the one we did on Tuesday, our monthly Lunch and Learn series, all count as a live session. If it's pre-recorded, then that counts as an alternative learning. Or if you're doing something like a home study booklet or journal or our virtual book club, those count as alternative learning credits. You can find alternative learning credits both on the Michigan Social Work Continuing Education Collaborative website. NASW National has a whole range of online CEs, and they opened up a bunch of free ones right now as well. Let's see if there's any questions around that right now. No, great. All right. One of the things that we have been following is trying to get some sort of crisis hotline up and running during this crisis. And so during one of this week's press conferences, the governor did announce that they are opening up a Warmline here in Michigan. So the Department of Health and Human Services has launched this Warmline for Michiganders living with mental health conditions. This is really a peer support line, not really a mental health hotline. So we know that folks may get referred from these, but folks can call 888-PEER-753, and it is open 7 days a week. It is, as of right now, it has a limited time from 10 a.m. to 2 a.m. I guess that's most of the day. We also know that Wayne State has their hotline. I think that's the next line. Yep, the Healthcare Provider Support Hotline. So this is an opportunity if folks are interested in volunteering their time. They have partnered with the College of Nursing and some other departments at Wayne State for this hotline, specifically for first responders and essential workers. So you might be in contact with a nurse or a doctor or possibly another social worker who is on the front line and may need some emotional support right now. And so they are accepting, if you go to the Wayne State School of Social Work website, you can find how to get your name added to that hotline right now. In terms of legislative updates, we actually will be having our legislative social policy meeting today at noon. That meeting is going to cover some of the future budget issues. So if folks are interested in kind of listening in or have thoughts on where social work can fit into the budget, that meeting is going to start at 12 o'clock, and that you can see that call-in information is on the screen there. You can also find that on our website. But one of the big things is we are working with several of our legislative partners and our lobbyists to make sure that social work is in the state budget, and especially in the appropriations area of the budget, because we know that that is where the funding is, and how specifically this mental health issue will continue to be addressed going forward from here. And I see Algeria on the chat log who says, please join us. Yes, we would love to have members continue to join that group. And if you've ever had questions about where does NASW make their positions about policy issues, it's LSP, our Legislative and Social Policy Committee. That's a member-driven and led subgroup of our organization, and they meet every month to talk about important legislative and policy topics, and then they figure out as a chapter, what do we take a position on, what do we want to get introduced, what do we oppose, and then our second political kind of wing of our chapter here is our political action committee. Now, that's not really relevant right now to COVID, but that's our part of our membership that helps endorse candidates. So we know that there's a giant election coming up later this year and lots of smaller local races that are also really critical. So if you are feeling the real need to be political right now, which we know many folks are, that's a really good also piece to be a part of. Please feel free to reach out to Algeria, or our chair, co-chair's name is Angel Foster, and they can get you added to those. It is a appointed group, so you just really have to express interest, and then that goes through our board president to make that appointment. But some really important chapter groups on policy level. Okay, so one clarification that we have been getting around licensure applications, this mostly is going to impact students who are graduating this semester, is how do you submit an application right now? And the current state of affairs is the LARA office is all working remotely. They had originally put out a notification that they wanted applications emailed. That was not correct information. They quickly changed it in about 24 to 48 hours. What they would like is if you are an initial applicant, that you should be paper mailing your application and your application fee. All of the additional documentation, including your transcripts, still can be emailed over to LARA, but your application itself at this time still should be paper mailed. Now, that very well could change if this continues to go on longer. Social workers have never been able to put an application online for new licenses. So that may change, but I don't know if the state system allows that yet. I know that they are working on it. So paper mail in those applications and your application fees. There is still somebody checking the mail at LARA. They're processing applications as normal as possible. There doesn't seem at this point to be too long of a delay in when they're processing them. So for folks who may have anxiety that are graduating this semester, at least this piece should be running fairly smoothly. Another update from LARA, this also comes from one of the executive, this one's not the executive action, but if you are a limited licensed social worker and you are on your last renewal of your limited license, so you're on your 6th renewal, and you were not able to take your test because the coronavirus made your exam be canceled, LARA will allow these licenses to be valid for an additional 6 months. So this is really great news for those folks. You get a 6-month extension. What you should do is still email LARA. We don't want to assume at this point that they're just going to auto-extend people who are at their last year. So if you are in this boat, please email LARA, tell them when you had your test scheduled for, and that you would like the 6-month extension at this time. Some other clarifications from LARA around fingerprinting. So this one is a tricky one. So some fingerprinting organizations still are running in the state of Michigan. What LARA is saying is if you need your fingerprints taken for your license, you should still attempt to do so. If all of the organizations in your area are closed or full for the next couple of weeks, you may be able to get that requirement waived currently. Only if they are closed or full right now. Again, document, and if you are requesting that to be waived, make sure you email LARA and have that documentation attached to that. And what the Board of Social Work told us right now is their advice for everyone is just to remain as patient as possible, help each other, and document everything. That seems like the mantra of social work in general, if I ever heard one. Remain patient, help each other, and document everything. So no different right now. We're just in somewhat of a different crisis. And then kind of the last piece that folks have been asking about is, can folks practice in other parts of the country right now? Can non-Michigan social workers see Michigan residents? So non-Michigan, so Ohio people or Indiana people or California people, they are allowed to see Michigan residents right now. Under Executive Action 2020-30, that has opened up some of those licensure requirements temporarily in terms of reciprocity. Some other states have also done that. I did want to show, so if you are interested in seeing a client from another state, or maybe your client is stuck somewhere right now, or had to go home from school or whatever, if you go to, and let me just bring it up really quick, ASWB website, which is just aswb.org, you'll see this COVID-19 updates right in the middle of the screen. If you click on Read More, there'll be a couple of options that are brought up, and you want the middle one for social workers. So if you click on that link, there'll be a drop down that pops up, and it will show you all the different changes right now that are happening in as close to live terms across the country. So if you scroll down to Michigan, there was not a Michigan tab here like a week and a half ago because Michigan had not made any changes as it relates to reciprocity. But we have since then, and you can see that with the executive actions, some articles of the Public Health Code are temporarily suspended, specifically as it relates to people working across the state boundaries. So if you know that a client is in a different state, you can use this drop-down tab to find out where they are and what that current rule is, or if it allows it. So ASWB is what I'm recommending people use. It's the most up-to-date. And if you hear something different, they do have a contact person here if you find something. I know that they're trying to keep this updated as best as possible, but everything is changing every day. So that's another good resource for folks. All right. I just showed that state list. As it relates to testing, as of right now, all testing sites are, well, not all, most testing sites are closed until the end of April. There are exceptions being made for essential workers, mostly in other states, if someone needs to take their exam now. Now, since Michigan has allowed for a 6-month extension of a limited license to be able to take the test, I'm going to guess that they're not going to grant people the ability to take an exam before May 1st. But if you are somebody who is limited license and wanting to schedule your exam, right now you can do that as long as you schedule it for after May 1st. Now, if things get extended, then you can always switch your time around, and Pearson and ASWB are being very flexible and waiving any sort of fees to switch dates at this particular time. We will have this webinar available and uploaded onto the NASW Michigan site, probably either later today or at the latest on Monday, if folks need to rewatch it or if they want to share it with folks. A continued action alert from our national office. And so one of the things that I know many of you have been asking about is audio-only services. We know that many of the more local insurances have opened up the options for doing audio-only. Medicare has still not done that, so we are asking folks to please write your legislators at the federal level about that. NASW has put together, if you check your email, I think they sent it out last week, maybe another time again, but if you click on that, it's a really easy form to just complete, and that will send it right to your senators. We know that that's really important right now because not everybody has access to video technology or is comfortable with that, and so we want to make sure as many of our clients can be seen as possible. This is just a resource I wanted to make sure folks knew about. This came out from NASW this week. It is a new practice update about vulnerable and marginalized populations and COVID-19. So this came out through your email, but I'll just show you what that looks like real quick. It's a 18-page guide and document all around implications for marginalized populations right now as it relates to social work practice. There's some resources in here, there's some data, and this includes incarcerated individuals, so immigrant folks, detained immigrants, homeless populations. So lots of good stuff here. Another resource for folks to check out and utilize in their practice. The national office also has 2 webinars coming up. One of them is later this afternoon. I believe they will be recorded. It may not be available immediately, but probably soon. Today's webinar is going to be on race, xenophobia, and COVID-19. So kind of along the lines of the practice perspective that they put out. That's from 1 to 2 p.m. today. And next Tuesday, they're going to have a Q&A session around ethical, legal, and clinical considerations for social workers right now. And so that'll be similar to kind of the webinar we had yesterday, but more of a Q&A format, and that's an hour and a half and also free. And that's going to be hosted by the NASW Office of Ethics and the General Counsel. So some really good resources there, folks. I did a demo of our website earlier. The National Office, socialworkers.org, has a lot of good stuff on their website right now. Also, I have been recommending that folks check out the My NASW platform. That is where you can share resources with members at any time. And then they also have some ethics resources. I'll quickly just show that I'll show the national site and how to access the My NASW community. This is a fairly new feature. It's maybe a year and a half or 2 years old. But if you're a member, what you're going to do is you're just going to go to this top part where it says My NASW. And if you click that and go to visit My NASW community, it'll probably make you log on here soon, or maybe it logged me on already. You can go here, and if you go into My Communities, yeah, that'll make me log on. And then it will show you all the different forums that exist throughout on the national level. And you'll see there's over 23,000 discussions going on at the national level. But if you go into the all member forum, that's the big one. You'll see lots of probably pretty critical questions that you may be having. Does Medicare now allow audio only? Vulnerable therapists, ongoing telepsych, coping skills, teletherapy, lots of stuff around teletherapy right now. But you can go in, you can share resources, you can upload documents. There are people putting in templates in there. So another way for folks to engage with folks all across the country right now. And that is a fairly newish platform, but if you go to the library feature at the top in the middle, you'll see that that's where all of the documents that have been shared live. So you'll see a whole bunch of stuff in here, research, practice alerts, some job stuff in there. So that's the My NASW platform. Two job openings right now that it relates to COVID-19. The VA is currently recruiting social workers all across the country, including in their several Michigan locations. So we know that folks are in very interesting career binds in some of our field right now. So there are some opportunities that are open and hiring right now. The VA is one of them. The Department of Health and Human Services is also having folks apply for certain jobs, and specifically in alternative care facilities. So those jobs are open right now. Those are just in the last week that we have heard about those positions. If you hear about specific needs for careers, please let us know if you're hearing about job openings. Also on the NASW Michigan site, anybody can post a job for free. So if your organization is hiring, please feel free to post your positions there. Some community resources. So I talked a little bit about the health provider support line from Wayne State. That number is listed below. They have also put out a tips and practices for providing mental health services. It's a really nice short guide for folks through Wayne State School of Social Work. Our partners at Welcoming Michigan have put together a resource guide for assisting immigrant communities throughout the state. Medicare has put out a video on payments and coverages right now. And then just this last week, the U of M Poverty Solutions put together a guide on how to make sure to get your stimulus check. I know some folks that has hit already, some folks that has not, and then there's some folks who are struggling to figure out if they get it or when they get that. So if you visit poverty.umich.edu/stimulus checks, you can access that resource there. Okay, so now I wanted to just open it up. See if there are any questions that have come through, or if folks want to share anything that's going on in their practice. I see that our region rep Sarah said if anyone has experience in medical social work, they would be a great candidate for temporary positions at the Detroit VA. Yeah, absolutely.
Dwayne,
Max.
this is Max. Just a second. One of the things that occurred to me, I also have a private practice. And what I'm seeing in my private practice is more and more challenging cases, more and more folks talking about suicide, people who would use substances, going back to substances. And I'm realizing that that may be true for others of you who are in private practice. So I would like to start kind of a support group for clinicians during this COVID-19 period to talk about the types of cases we're seeing, not just the impact of COVID on our clients, but the impact of our clients on us and the responses and our fatigue dealing with very significant crises. And I'm curious to know if any of you would be interested in that, if you think it's a good idea. We would set up a Zoom call similar to this that would be really just focused on clinical issues and the impact on clients and therapists. Are there any comments?
Some folks in the chat box think it's a great idea.
Okay. So I will talk to Dwayne, and I think Julie Weckel is also on the line, and Julie heads up the private practice group. So she and I and Dwayne will find a time to set this up. I know it's kind of difficult to find a time that fits everyone, but we'll do our best. So if you could send in your names, and if you have colleagues who would also be interested in joining, if you could send those to Dwayne's email, then we can begin to collect them and take a look at them to begin to discover dates and times. Does that sound reasonable?
I'll put my email in the chat box too. Which I'll put up on the screen. Anybody else kind of interested in sharing how their life's been, either good or challenging things that they've found with what's going on right now? That's okay, you don't have to. Well, folks, we don't have any other updates for you for this week. That's all the main ones. So I guess for right now, Max and I will work on figuring out how to get another call set up. We have one more technical schedule of these Friday calls for next week. We will likely be extending that as this continues to go on. And I really like doing this sort of format. So probably going forward, at least once a month, we're going to do some sort of a member update that includes some other things that we're working on. Just so folks are aware, our chapter elections are going to be opening on Monday. So please look out for your email and please vote in those chapter elections if possible. That's kind of where we find who makes some of our decisions as a chapter. It puts our leadership role together. So that'll be coming out on Monday. Some of we just did get a comment from Joanne, school social worker, and had to follow up with 504s. This is challenging. Yeah, we definitely know for school folks, this has been a unique time too. As students are working remotely, as schools are in this weird limbo of not being open but still having to serve, and that you all are transitioning your work online as well. And we want to hear from folks that if you are at organizations that are doing really great things, or if you have really unique programming that you've had to implement because of this. We've been getting several media opportunities reaching out to us, both at the state and at the national level. So we're trying to pluck in social workers to those opportunities when we get them. So if you have a good story to tell, if you know somebody who's on the front lines who is able to share and talk openly right now, or at least talk somewhat, we would love to have their names. Please feel free to shoot me an email with their contact information or your contact information. And if you can write a little blurb about what you're doing, that would be helpful too. Algeria said we'll make sure to provide some updates related to school social work on our next call. Our lobbyists have been working on that. So great. It looks like specifically as it relates to funding, as some of that gets worked out. And we know that the legislative session is in this weird open, not open state right now, but the budget is still being worked on. And we know that that's going to continue to be an important thing that we do not overlook, and where social workers fit into that budget. So we'll have that call at noon today if folks are interested. But other than that, if there are no other questions or thoughts, we can go ahead and wrap up today. So thanks, everyone. I hope everyone has a good weekend, and hopefully we'll see you next week. All right. Bye, everyone.